Bismillahirrahmanirrahim. Today our topic of discussion is routes of drug administration. It means that how a drug is introduced to the body. There are main two routes of drug administration: local route and systemic route. In local route, the drug is directly applied onto the surface where action is required, and in systemic, it moves through several organs and then it reaches to the point of action. Local route of drug administration. Local route of administration means that the drug is directly applied to area where action is required. It is of three types: topical, deeper tissues, arterial supply. Topical route of drug administration. It is directly applied on surface. It may be in the form of cream, powder, ointment, lotion, drops, etc. Deeper tissues. In deeper tissues, the drug is directly applied or injected to the tissue cavities. These drugs are administered directly to the tissue cavities. For example, intra-articular. In this drug is directly administered to the to the joint cavities. Intraperitoneal to the peritoneum, abdominal cavity. Intravitreous in the eye. Intrapleural to the pleural cavity. Arterial supply. In this route, drug is directly injected in the arteries. You will think that arteries are distributed all over the body and blood is also distributed all over the body. So how it is local? These drugs are local in a sense that the artery supplies to a specific organ. For example, drug administration to femoral and brachial artery for limb malignancies. Systemic route. Systemic route. In this route of drug administration, the drug is distributed to other body parts apart from point of action. It is of two types: enteral and parenteral. Enteral route of drug administration is the route which passes through intestine. It is of three types: oral route, rectal route, subcutaneous route. Oral route of drug administration. Advantages: it is safe, painless, easy to use. Disadvantages: action is slow. First pass metabolism is present. It means that when drug is orally taken, it passes through GIT and in intestine it is absorbed in the hepatic circulation. Then it travels to liver and there its first metabolism takes place and this is called first pass metabolism. This route of drug administration can't be used in patients with nausea, vomiting and unconscious. Rectal route of drug administration. Rectal route can be used in unconscious and patients with recurrent vomiting. Disadvantages: absorption is unpredictable. It means that when rec- when drug is placed in the rectum, the drug may be absorbed in the external hemorrhoidal vein or internal hemorrhoidal vein. When it is absorbed in the external hemorrhoidal vein, it bypasses liver. So it bypasses first pass metabolism. But when it is present in internal hemorrhoidal vein, it passes through liver. So there its first pass metabolism takes place. So absorption is unpredictable. It may be absorbed in the external hemorrhoidal vein or internal hemorrhoidal vein. This route is inconvenient and embarrassing. Irritant drugs can also cause rectal mucosal inflammation. Sublingual route of drug administration. In this route of drug administration, the drug is placed below the tongue. Below tongue, there are veins through which these drugs are absorbed in the body. So this route is parenteral route, or it may be the drug may be swallowed and passes through GIT, and it may be absorbed through GIT. So this is the enteral route. So this route of drug administration is both enteral and parenteral. Disadvantages: only lipid soluble drugs can be used. Liver is bypassed in just parenteral route. Parenteral route of drug administration. It is the route of drug administration which bypasses intestine. It is of two types: injectable, non-injectable. Injectable. It is further divided into five types: subcutaneous, intravenous, intramuscular, intradermal, intraosseous. Subcutaneous. Skin is made up of three layers: epidermis, dermis, hypodermis, and below hypodermis there is subcutaneous. In subcutaneous, we directly inject in the subcutaneous tissue. And in this route of drug administration, we don't have to prick more, so these are self injectable. Intravenous, also called IV, most important route of drug administration, fastest route of drug administration, and 100% bioavailability means that drug is 100% available to the body. Intramuscular, in this we directly inject in the muscle of choice may be deltoid, triceps, gluteus maximus, rectus femoris. Intradermal, in this route we inject directly in the skin, maybe in the dermis, epidermis, or hypodermis. Intraosseous, in this route drug is directly injected in the bone marrow. It is the second fastest route of drug administration in 100% bioavailability. Non-injectable is of further three types: nasal route, cutaneous route, inhalational route. Nasal route of drug administration. In this route, the drug is directly applied on the nose, so the mucous membrane of nose readily absorbs the drug. In this route, liver is bypassed. Disadvantage is only certain drugs can be used. Inhalational route of drug administration. Volatile liquids and gases are administered by this route of administration. And in this route of drug administration, absorption takes place from the alveoli of lungs. The main difference between the nasal route and inhalational route is that in nasal route, absorption takes place in the nose from the mucous membrane, and in inhalational route, absorption takes place from alveoli in the lungs. It is the fastest route of drug absorption. Cutaneous route. In this route, drug is directly applied over skin for slow and prolonged absorption. In this route, liver is bypassed. Disadvantages: this route of drug administration is limited to only lipid soluble drugs. Thank you so much.